Hey, what's up, Canada and beyond? Welcome to a kind of a rescheduled or do-over evening this evening. I hope you guys are all finding a little bit of peace and comfort and happiness in your holiday season. So we have a unique opportunity tonight to sit down and have just a kitchen table talk with some people that are out there connecting hearts with some of the things that are going on in Alberta. We tried to get this show together just before Christmas, but it didn't work out. These are busy, busy people, but we do have them all rounded up here somewhat tonight. One of them is in transit. But some of you guys may have heard about a Alberta Boots program. And if you've seen the thumbnail, you've seen a little bit about that. So tonight we've got the chance to meet the organizers. These are not the likely candidates that you would see out doing these kinds of things in your community, but I want to introduce you all tonight to the minds and the hearts behind Alberta Boots. So we have got with us tonight Todd, Sierra, and Kate. Welcome to What's Up Canada. Thank you for taking the time to hang out with us in our community and our family here over the Christmas break. I appreciate you taking time away from your families and your lives for joining us. And I'm so excited for you guys to get a chance to deliver your message, to tell people what it is that you guys are doing. And we'll start from the beginning. Kate is on the road right now, guys, so bear with us. She doesn't have a camera with her today, but she is still with us, and she can hear us and communicate. So if you guys have any questions along the way, or anybody here on the panel wants to address something in the chat, this is kind of just an informal get together. But I came across some pictures that conveyed exactly the message that I was trying to bring to people, not specifically in Alberta as you guys have, or where you guys started from, but with what's been going on in Canada, there's a problem, and there's people being forced out of positions that they are uniquely qualified for. And I'm concerned about the people that are not getting what they need out of our healthcare system right now. And what you guys have done is so beautifully delivered a message with your Alberta Boots idea. That's where it started for me. I found you guys about a week after you guys got started. So tell us a little bit, guys, about how this came to be and how you guys are an unlikely trio. We've had a chance to talk a little bit pre-show, so I know a little bit more than the audience does. So I might steer some questions back to some of that we've talked about. But yeah, tell us when you got started and the whirlwind that you guys have entered into.
8.
And Kate is gone MIA. She must be in a dead spot. But I'm sure she'll join us again. But it was Kate.
So hopefully she'll pop back in. Todd, if you're okay with me answering it. Basically what happened was, we were in quite a large group, like online. None of us knew each other from Alberta, mostly from kind of an EMS, AHS background. And so what happened was we have been talking since about September, but it wasn't till, approximately 2 weeks ago that, Kate kind of someone gave her the idea, like, you know what, hey, you guys should line up boots and shoes to like represent healthcare workers and the empty shoes, the empty positions they're leaving behind in Alberta Health Care. And so basically she just reached out in the group and was like, hey, this is kind of what I want to do. I want to create some drop points all over Alberta so that we can get a wide reach and people can just come drop off their shoes, and we'll find a way to get them to Edmonton so we can line them up and take this great big photo at the legislature grounds. And so basically we didn't know each other, but just by talking, pretty much Kate, Todd, and I came together at my place, and we just took off on this project and committed to it.
Welcome back, Kate. I've let people know that you're kind of en route, so hopefully you can hear us and you'll be with us for a little while. Sierra was telling us how you guys kind of initially came together. So a little bit of context for everybody out there. It just so happens that three of you guys are all working in emergency services, correct?
Yeah, it's kind of a weird coincidence how that happened. Our project is for anybody in Alberta in healthcare who's been put on LOA, and all of us work essentially in the same area of Alberta, and all of us are paramedics. So,
and this was one of those things that struck me immediately, and one of the first things that I asked you guys when I had a chance to talk with you guys last week was how many years you guys have in. You guys are all paramedics, basically, for a basic understanding for the audience out there. Kate, you?
I've been doing this for 10 years now.
10 years. Sierra?
10 years.
Todd?
Almost 15, but 20 years in the industry. So
here we are with 40 years of experienced first responder medical personnel that have been put on leave of absence. This is alarming to me as a citizen who, or as a person who, somebody like you has saved my life on a couple of times, and now you guys, for arbitrary seeming reasons, have been taken out of the workforce. And a lot of people are wearing this same concern. So a lot of people are behind you, and I'm sure this is evidenced and reflected. So to go back to where this all started, Sierra was telling us it started out with just you, Kate, and starting to set up some drop points. What happened?
Yeah, so I kind of have started telling people the boot project was actually an accident. It just kind of happened, and we were along for the ride. But how it began, I suppose, is I was just on one of our Telegram groups or support groups for workers who've been put onto LOA or were going to be put onto LOA at that point. And someone said, just made an offhanded suggestion that we bring our uniforms down to the Parliament buildings or the legislature building, so that the government can just really get a feel for the people who are being affected by these mandates. And I thought that was a brilliant idea, but we couldn't bring our uniforms because they're all got company logos and stuff. And I was like, well, what if we bring our shoes? And I just put out a poster onto the Telegram group that said, hey, if anybody else is interested in joining me, I'm going to leave my shoes on the steps of the legislature building with a sign with my job title and years of service, and just leave them up there on the steps so that any government official walking in and out will now have to grasp a little bit of the humanity of this project, right? And see, these are real people who are being affected by these mandates. So I put a poster out, and it started circulating around, and pretty soon I had people contacting me from all over the province being like, hey, I'm in Grand Prairie, I'm in Lethbridge, I'm wherever, and I want my boots to be included too. So we ended up setting up drop points. So volunteers in 20 different communities in Alberta volunteered to be basically locations that people could bring their shoes to. And over the course of 3 or 4 days, I guess, we collected in a ton of shoes to those drop points. There was some interest in the beginning, but honestly what got it started was one of the guys from Lethbridge posted a photo of the boots that had come into his porch overnight. And there was a pair of boots there with medals attached to them. And there was a pair of boots from a firefighter. And just in those 10 or so pairs, it was moving. Like, it moved me to tears to see that. And so many other people saw it as well. And were like, I want my boots in there too. So over the course of 3 or 4 days, yeah, we had just about 800 pairs of boots come in.
Amazing. Absolutely amazing. And so this must have been absolutely overwhelming. I know what happens with something like this. It's the beautiful things that happen out of nowhere when you least expect it that change the world the most. And I'm sure all of your worlds have been deeply impacted already in the last 2 weeks.
Very much so.
Yeah. So what's been the response? So you started to gather the boots from the time you went out into the world with this, and it started till you had them all set up on the ledge in Edmonton. What was it, a week?
It was 1 week. Yeah. The mandate came into effect on December 13th. And 1 week later was when we had all of the booths set up on the steps of the legislature, just showing the humanity of who had been affected.
And I think I saw a sign in amongst the that were there that there was more than 12,000 hours represented by the boots that you guys had gathered at that time. Is that pretty close?
Yep. Yeah, that's correct.
But years.
Oh,
12,000 years, correct. Sorry.
A combined service.
That's an astronomical number. That's something that most people really have a hard time putting their brain around. And I know when I first met with you guys in that first video chat, I asked you guys a question and I put you on the spot, knowing that you guys don't think that way, because I have a little background in that as well. And if anybody had ever asked me, I would not be able to answer them. But through some of you guys' research, just to ballpark out there, it's not an unusual number for somebody in your guys' position to affect or touch or impact 7,000 or 8,000 people a year. So for the people that are out there, 12,000 years, that's a lot of people that are not being represented or not getting a fair shake in this system. Is this something that you guys saw starting to happen, or just kind of really caught you guys off guard when the mandates were coming out? Because I know what it's like in your guys' world. You're head down, butt up. You're not paying attention to the nonsense that's going out in the world. That's somebody else's circus. So for you guys, where was it that you guys started to come into the picture?
For the project? Do you mean for like when we were getting put on unpaid LOA?
When you knew that something was really wrong and you guys had to not just pay attention but get involved.
Are you guys okay if I go?
Yeah, absolutely.
Kate, are you okay?
Yeah. Sierra, go for it, girl.
Yeah, mine was like a little bit more delayed than a lot of other people. Like, I have a medical condition that I don't need to talk about, but basically what happened was I almost died of sepsis last December in Edmonton. And so I have this systemic inflammation in my body. Like, I highly react to like exercise, everything. I can get heart palpitations just from running. And basically, like throughout the year, I was told to like kind of watch my condition. You can, if you get sepsis again within 1 year, you only have a 25% chance of surviving depending on the severity. And so I was like, oh, wow, this, like when the mandate came in, I was like, oh, this should qualify for a medical exemption based on the medical knowledge I use to treat my own patients. And so when I wasn't able to get a medical exemption, because AHS's criteria for medical exemption is just so narrow, like basically you have to have had a reaction to the first COVID shot. Or
and even then, yeah. I know many.
Yeah, and even then, yeah, or have an active case of myocarditis. Mm-hmm. So then what happened was then I was kind of like trying to get that exemption, trying to speak to a specialist, and I met a roadblock pretty much every step of the way. And I think it was like November, once they just kept extending that deadline, that I was like, oh, this is very wrong. Like, I'm not even being advocated for as a patient in regards to this policy that's affecting my job. And then when I got put on unpaid LOA, I was just kind of like, what are we going to do? And then Kate's like, I need an Edmonton drop off. And I was like, I'm there. That's my story.
And just for some clarification, the reason why these the mandates actually have had they were paused with we were given 1 month's notice, and then they were paused, given another 1 month's notice, paused, and then 2 weeks not paused, and that was up to December 13th. And then the people are being put on LOAs, as we refer to them, involuntary LOAs, leave of absence. It's for two main reasons: being unvaccinated or not willing to disclose that status. And from that, there's actually a few reasons why we're not treating this as just a pro or con vaccination issue. We have our personal opinions on that. Other people have medical reasons. Other people have religious reasons. So it's not simply just we don't see ourselves as an anti-vax movement at all, but more of a right of us healthcare practitioners to be treated the same way that we have to treat our patients, and that is informed consent. And if we agree or disagree with them personally, we still have to respect their choices in that and treat them equally with dignity and respect as well. And we just want that same thing to be afforded to us that we have to afford to them. Because if we didn't do that, we'd be fired. We'd be dragged before our colleges of various medical professions, probably disciplined, and even face criminal and civil trials and lawsuits. So it's our movement and our focus is just to be able to have that right to choose what we want to do without being bullied, coerced, intimidated into making that choice.
Yeah. And we need to ask about timelines there, Wayne. It's only been since this March or April that paramedics have even had access to the vaccine. I remember this past January, there were huge fights to try and win paramedics the right to be vaccinated when the vaccines first came out. And it was actually quite a struggle. And then they finally gained access to them. And then already we're seeing it where if you don't
And just to clarify, Kate, if you don't mind,
Yeah.
if I recall, that was actually not afforded to us when it was afforded to like ER staff, was it not?
That's right. That's right.
So other healthcare professionals received it before paramedics even did. And firefighters are also being first responders, or I believe were also late to be afforded the opportunity to get vaccinated if they choose. And I mean, we like to, everyone's sort of frontline staff, but we sort of probably feel that the people who are going into people's homes, businesses, side of highways, are a little even more frontliner than some of the other ones. And we don't know necessarily the risks that we're going into either. So it's really been interesting of how they choose to do things. We try to wrap our heads around it, and in order to avoid getting headaches and whatnot, it's sometimes good not to think too much about things. We all want to and do.
They've made it impossible to find common sense in it, and I hear the same thing when I interview RCMP officers or police officers. They've been going through the same double standard, the same game where it's been weaponized. The rules have been bent and twisted and weaponized. It's all about compliance, not about the actual services that you guys provide. And this is the significant part of the hypocrisy of all of this. You guys a year ago were the heroes. You guys were going into those places that were, supposedly overrun with this, terrible killer illness. And you guys weren't, your guys' protection was, other than out of PPE, was a very little concern to the establishment. So you guys were left hung out there day after day after day after day, and then all of a sudden, now that the fact that you guys are not taking part in this, now this is leverage to dismiss you guys without representation, communication, negotiation, any of these things. This is what we, the people, I guess, are seeing out of this. Is that a pretty fair assessment?
Yeah.
I think so. And you touched on, I believe, a really key point there of personal protective equipment. We're given gloves, gown, goggles, face shields. Some even can use both. N95 masks, not just surgical, but higher up. And we've been under the impression too that gear is enough to keep us safe from COVID, both getting and giving it to patients and receiving it from them. And so with that in mind, it seems to be a little confusing where if that's sufficient enough to protect us, why are there new steps required? So is it that either that gear is not good enough or it is good enough? That now leads to the next question. Then why do you need to add more if it's good enough? And if you need to add more, then that's kind of saying it wasn't good enough. So there's so many confusing messages that are going different directions at times.
Totally. And sorry.
Go ahead, Kate, please.
Well, Wayne, you were saying even last year we were regarded as heroes. I don't think we even need to look at the timeline like that. Like, as of December 13th, I was considered a hero. Like on December 13th, on my last day of work, I saved someone's life. And the next day, I was considered ineligible for work because I was more of a hazard to be there than
Great
not.
point.
Like it's
You went disposable overnight.
overnight. Yeah, it's
Mhm.
that to me is the ludicrousness of it. Is I worked pretty much every day for 21 days leading up to my LOA because I knew that I was going to need the funds, right? But I was a hero up until the very last day, and then after that, I'm disposable. And not because my company wanted to get rid of me. My company fought hard for me. Every single one of my coworkers is rooting me on, and they're like, "Kate, we believe in you. Keep fighting. You can do this." It's not because of them. It's because of a government mandate. And we have good people and we have bad people. And as of December 13th, Kate, Sierra, and Todd are bad people.
I've used this analogy to describe that often in the past. We didn't change, but the scale tilted very, very
Yeah.
hard. And this is disturbing because it's the people that are generally living life and making the world go round that don't see those kinds of things happen. And now they're going to be dealing with the fallout of this. And we didn't want to get on the show into any of the science debate or any of those kinds of debates. That's not for us. What we're trying to show is what's left behind. And even for myself, we've gotten to a point where I'm afraid of the system or the lack of system because there's very next to no trust left in the system because the people that were the advocates for us out there are now sitting here on a TV or a computer screen and a Zoom call with me rather than out there making an impact. And that's got to be tough on you guys, knowing what is going on, and you guys can't be out there doing what you guys are hardwired to do. And this is just, I'm hearing from three of you, how many hundreds, thousands are in the same situation?
Yeah.
That's
And the specific number to that question is also quite confusing. AHS, I think, is published in the neighborhood of 1,600, and it's we're just speaking probably all anecdotally on that, but it really feels like a lot more people than that. And unfortunately,
in actuality, it is, because that's 1,600 that have been removed from the system over the last year. How many have left willingly because they saw this point coming, or they didn't? They couldn't find a way to navigate to get to this point. That, I think, far supersedes already. So the system had already been seriously depleted over the last year, and I think those numbers are pretty common to the people that are out there looking. We talked a little while ago on some evidence, some information that came out that there's more than 3,000 plus middle managers in Alberta Health Care system making more than $200,000 a year to cover 318 ICU beds. And those people haven't missed a day of work. They haven't missed a day of salary. And they also haven't missed a day of impacting the actual physical reality of a patient, because they don't deal with people. Those people aren't being pulled out of the system. You guys are.
That's right. And that 1650 that they released, I mean, I'm just quoting the news article and what AHS reported, but they reported that was the percentage, like that was the number that came from the full-timers and part-timers that were put on LOA, and that is the full-time and part-timers of AHS. So that's a direct AHS employee. That does not cover Covenant Health. It doesn't cover other contractors that were also using the AHS's policy and forced to fall under that. So they've only reported AHS employees, not contractors.
It's a tiny percentage. And it goes to show that, I mean, the system is broken, has been broken for decades, but it's at a point now where it's unsustainable going forwards. And
One of
Yeah,
my other more common quotes: insanity is unsustainable, and we've reached that point. I saw a notification today that there was an ambulance coming from Banff to answer a call in Calgary today.
Oh, yeah.
I think that was the Airdrie ambulance, right? Like Airdrie went to Banff for a transfer, and then they got called to go back to Calgary to do a call.
And,
So
and
they
this
weren't
knowledge,
yeah.
And this knowledge is based off of our union's website, HSAA EMS. We've been publishing that data, so that's who we're hearing it through.
Yeah.
And so,
Let's just-
but they've had, I believe, I always get mixed up between Innisfail and Innisfree. The one that's close to Red Deer, that ambulance apparently responded to a call in Calgary. So Calgary is having ambulance dispatched an hour to an hour and a half away from Calgary to there, and that's not an entirely new thing since this mandate went into effect. They've been having similar issues before that with staffing, and so it's for me hard to imagine that this LOA mandate doesn't only increase that difficulty of staffing. So it's kind of an interesting
That's
time
right.
to let go when the system is already suffering, to even let more people go.
And there's at least like a third, if not more, of personnel that have gone off on stress leave alone this year because of pandemic related issues. And that number, we've heard through the rumor mill, has gone up to 42% since the mandate came into effect. So this isn't just people trying to take time off because of the mandate. This is our staff left behind who are allowed to work because they are vaccinated, but they are now working 14, 15-hour shifts regularly with overtime, and they are taking that time off because the system has been under increased pressure up until this unpaid LOA came into effect.
And the thing is, we want to be there fighting in the trenches side by side with them. And it's, this mandate isn't just like, it hurts us to not be there to help our coworkers. It hurts us to not be there to help the people of Alberta as well. I mean, at least talking to most of the people who are on the LAs are some of the most caring, compassionate people I've ever met. That are the people I would want to be caring for me, for my family, for my friends. And this is really the quality of people that are on these mandates right now are exactly the ones you want. Even beyond that, you have the people who will, if they see someone else's as a patient in a hospital or on the ambulance, their rights not being respected or being abused. I know without a doubt, these are the people who would be standing up for those patients. And it's a lot of really good quality, high caliber people that we're losing.
I've spent time in emergency services as well, and I know how intense it is. And when you start to take teammates out of it, and you start to have to cover those kinds of times, burnout is real. Burnout has always been a problem in emergency services in Alberta because it is a very challenging province to work in as far as for emergency services. Maybe not each, I guess there really isn't a difference whether you're rural or municipal. There's unique challenges that come to it, weather included. And this is a really tough time for me to find any kind of justification in what's going on for the way you guys are being treated. Is there anybody advocating for you guys?
There are some MLAs eventually who have definitely already been sounding that alarm before the boot project even started. As soon as, and so, for example, there's a Parkland MLA. I think, who did we say? Todd Lowen, Angela Pitt. There was one more. The one from Parkland. Getson. What's his name?
Loxanan County.
That's right. That's right. Yeah,
Shane.
Yeah. So like they have been kind of ringing the alarm and stepping up and, speaking to the government about it. But once this project got posted, like, wow, they all shared it. they all mentioned it.
And it's been hard for them. I can respect and appreciate to a certain degree that they somewhat have to tiptoe over the issue, because if they go full throttle onto things, now this is just me, not as a professional but personal, saying that there may not be likely to be a UCP person for much longer if they do that. So it seems that they had to be a bit in the background. We wish they would come out more into the foreground, but they probably see some things that we can't appreciate on their side of things. But they're definitely, I have noticed, probably in the last month and a half, a bit of shift on, I don't know if the right term is the aggressiveness, but more so
Intensity.
being much more direct. Sorry, you throwing a word there, Kate?
Intensity.
Yeah, which are coming forward. I know Shane, back probably 2 months ago, I started another little project on how these vaccine mandates are going to affect people. And I looked in also how, it affects patient care, in the sense of what rights are you given that you don't afford, or what rights must you afford patients that you are not being afforded yourself. I had around 100 responses, and some wanted to be just talk to me about it, but I gave Shane about 72 of them, and he actually tabled that book in the legislation settings back, I believe it was end of October 28th or something. I wasn't expecting that at all. He had initially just said he would pass it on to the Minister of Health, and that was even a bigger thing doing that. So there definitely is a bit of I would say, to use a metaphor, the winds have shifted a bit.
Yeah.
As the court of public opinion is who's advocating for you, is what that I'm hearing out of that. But I guess what I was kind of curious about is that you guys are generally are all employed by the province or some direction thereof. Is there organizations that are in the system that should be doing something, that should be taking this to task, or are taking this to task? Is there anything like that going on for you guys?
Oh, you mean the union?
Can you call them that?
The what? What was that, Sierra? I didn't catch.
I said, I mean, he means the union that we haven't heard from.
all of them. Yeah. I mean, this is like we touched on it before about, we don't really think the numbers are being accurate of how many employees are put on LOA. We've taken various projects to try and get that information from people. Obviously, we're just a group of paramedics and other healthcare practitioners, so we're not known from Adam, so to speak. But these are surveys that our union should be doing. HSAA, AUPE, QP, UNA. Forgive me, I don't work with the nurses. I know the RNs are UNA. I'm not sure about the LPNs, but all these various unions should just survey their memberships to see, are these numbers accurate, and then either have it as an agreement with AHS's numbers or refute them. But they're not even doing something simple as that.
Yeah, Wayne, and we've had troubles with the union as well. Like, the union, absolutely, this is their responsibility. When you have employees who are being forced into unpaid leave of absence against their will, that's constructive dismissal, and that is the opportunity for a union to step up. From the beginning, we've been going to our unions with this and grieving that this policy that Alberta Health Services has brought out is not right, and it's a change in our employment standards without consulting us first, and several other things. And the union, every union that I've seen, I deal with HSAA, but from what I've heard from others as well, has absolutely refused to address that. They've said, sorry, it's your employer can do whatever they want. I ended up filing a religious exemption, and when that was denied, I submitted a grievance to the union, and they said, well, we can look at grieving this for you, but it might take 18 months. So do you really want to do it? And that's been the general response. They support what the employer is doing, and they support it in so many words, openly.
And this is
from
one
the
of the
top
few
of the
times they
union.
actually have. Usually they're a lot more aggressive
And this
in
is
labor things, but they're not at all in these mandates, which is
this is the resounding message that I'm hearing from everybody, whether it's policing or all of the different branches of services that are being affected by this. Airlines, it's all the same thing. The unions have dropped the ball entirely on the workers' behalf. And from the top down, it is a resounding look, guys, we know this ain't right, but we're doing it anyways because the boss is a friend of so and so kind of thing. And we've literally got some of that in evidence and videotape from other unions. But it's the same thing consistently across the board. And it's sorry, go ahead, Kate.
Yeah, it is the same across the board. The unions who should be stepping up, and
I think he turned into a robot.
Yeah, we got a little R2D2 action going there, Kate. You know, in a bit of a rough spot there or something. But I guess you guys should be angry. You guys pay union dues. You guys pay for these people to protect you. That is the whole point and purpose of a union, is to protect the employees. So they've been taking money off of you guys for every day, every hour that you have ever worked. And now they are basically hanging you out to dry, take it or leave it.
And I can't give total props because I don't know all the details, but I believe the British Columbia Nursing Union have been one of the only few unions that has actually come out and said they're against forced vaccine mandates. I think we lost Kate there. Hopefully she gets into better service area. But yeah, you know, that's the thing here is, and we're taking this boot project as well, that it's not a partisan thing. I mean, we have our political sides, but the same rights to me to be able to say yes or no to a vaccine should be afforded if you're an NDPer, if you're a liberal, if you're a conservative, if you're a UCPer, if you're a libertarian, throw out whatever you are, everyone should have these same rights. I mean, that's how it has been up until COVID hit, that we did have all these same rights. And that's one of my biggest issues with the unions right now, is that they're taking a perhaps even majority membership view of if mandates should happen or not, and going with that, as opposed to even defending the minority members of the unions. You gotta represent everyone if you're the union. You can't pick and choose that we're going to pick with this side or that side. Either everyone has a right to say no to medical treatment without coercion and intimidation and bullying, little cliche that I keep saying, and you protect that right for everyone, or that right doesn't exist for everyone. And if that right does not exist for everyone, that's a very scary Pandora's box to open, because, you know, if it starts with this, where can it end up? And I think some of us have looked that this is potentially only a beginning of reduction of rights and freedoms. And, you know, we'd rather have that be kept and stopped from becoming even worse. And this is why, maybe I'm starting to get rambly, but it's, why aren't unions defending everyone equally?
Well, and this is something that I wanted to highlight specifically a little bit on that. And because there are cases out there, the Toyota union said no, the Toronto Police Union said no. There are, I believe it's the QP union, I think, for the United Airlines. They are saying no in court. So these kinds of things are happening. And I think that these organizational branches are starting to see an impact from that. And in Alberta, specifically, I think you guys had an impact already. And this is where we're going to kind of wind it down to catching up to where we're at right here, right now in real time over the holidays. We were supposed to gather on last Friday and to have this discussion and talk about what was going on. And then at like 3 o'clock or 3:30 on Friday afternoon, boom, bomb drops. And it kind of really rattled everybody. So Could please, Sierra or Todd, tell us about what happened there and then. I was a little disappointed, but I was like, "Oh, come on, let's go!" But I can well imagine you guys needed to catch your breath.
Yeah. If you'd like to go ahead, Sierra.
I don't know. You're really good at answering these questions. I want to hear your answer.
Just making sure I give everyone equal opportunities. So, yeah, Wayne. Again, I do apologize to yourself for canceling at the last minute, and to any of your viewers
It wasn't
here
me.
as
I was
well.
disappointed for. It was the folks that I knew that
Yeah.
were going to fall in love with you guys. There was a lot of people eager to hear from you guys. So
Yeah, and your viewers as well. So we appreciate that you've taken the time to interview us and give us a little bit of a platform, because, well, all the other ones, the big names, haven't. You can take that any direction you like to go. But what happened on that day was, and I'm so fuzzy on some of the details, but it seemed like the provincial government ordered AHS to rescind the mandate with conditions, and that was being that it will come into effect January 10th, and it will also be a requirement that all healthcare practitioners get rapid COVID testing done within 48 hours of their shifts. And now then that opens a whole other can of worms of some of the other issues, and that's why we postponed it, just to try and wrap our heads around what some of these other issues would be. But that's what happened anyways on that date. And it was deemed only temporary until March. And forgive me, I'm not sure if it's the beginning or into March or where in March, but it was so basically the three conditions
March 27th.
were 27th. Awesome. I see you're back, Kate. Welcome. It's mandatory testing, 48 hours before shifts, and temporarily until March. And there's so many directions that we're so not sure which way it's going, but I hope that answers that question.
To me, there was a couple of things in there that all struck me of major concern for all of you guys and everybody else that's paying attention. Was the first of all temporary, and second of all, it was like, okay, well, if you do this and you cover the costs yourselves, so another bite on you guys, and another.
Thanks for covering that one. We have to pay. That's one.
Yeah, it was like, okay, well, we'll because it's kind of inconvenient for us personally. I have a slightly different opinion. I think they kind of got a little bit of egg in their face when they came out with an extension on the mandates, and then had a 200-person party with no protection and all of those things for the government. And your guys's story was starting to grow, and with the exposure from some of those people, the court of public opinion advocating for you guys, I think they just didn't want to get the bad press of where this was going to go over the Christmas holidays, because it's a tough time for people. Typically, it's probably a really busy season for you guys. Even for me, when I was firefighting, that 2 weeks over Christmas was you kind of puckered up for a month before that, knowing what was coming. It was like waiting for a full moon. So all of this kind of transpired, and then they come out of this to try and save themselves with a temporary.
That's right, and also one of the things that we did is when we set up those 777 booths, which is how many were in the initial picture for the legislature, we kept count. So we kept count of how many nurses there were, how many mental health therapists, how many paramedics, how many paramedic firefighters, list goes on. There was 310 nurses in there, but one of the really important numbers that some of the MLAs really zeroed in on, there was just 58 paramedics on that list, which was enough to staff nearly 30 ambulances for a whole day in Alberta. And it was just one small, number. I mean, it's easy to say how many ambulances because it's two people to an ambulance, right? So once the MLAs kind of zeroed in on that number, that kind of, that's why the government kind of forced them to bring out the option of rapid testing.
And Sierra, perhaps another good group to focus on, which we always sort of touch base on, is how many mental health workers' shoes are counted, and tying in with the population overall mental health as things go on into year 3. Wow.
That's right.
3 years to flatten the 15-day curve, right?
And plus the practitioners being so stressed out right now. Is how many of those of this 720-ish shoes were healthcare workers or mental health workers?
Oh, of course. Yes. Yeah, I was only going off the numbers that are off the top of my head, but yeah. Well, it's hard to. I only noticed Todd Lowen when he shared it, talked about the ambulances, but you're absolutely right. Like, how many psych nurses? I wish we kept track of how many psych nurses were in there. How many?
I think it was like a good 40 or 50, wasn't it? Somewhere in there, 40.
You're probably
healthcare
right.
workers in that neighborhood-ish.
Yeah. It was definitely 38 mental health therapists.
Oh, yes.
Yeah.
That was the number I was thinking of. That.
Yeah.
And this is that's significant too.
Mm-hmm.
I mean, they're all significant, but
everybody, I'll tell you what, when you're flat on your back in a gurney, it doesn't matter whether you're in a hospital or an ambulance, the person that's looking down at you is the most significant person in the world in that moment. And I'm glad you guys brought up about the mental health care workers. It's something we try to not forget in some of the things that we do. And one of my dearest friends is actually a trauma practitioner. So we talk from time to time, and she comes on and does a show with us from time to time, helping people to understand that, that really the whole world is dealing from a certain level of trauma right now. They're trying to survive, and even the people that seem to be doing okay, I can guarantee you there's some sort of trauma and impact on them and everything that is going on. And what is happening right now is unjustified. They cannot demonstrably justify that what they're doing to you guys makes sense in any way, shape, or form. And that's I'm glad that the Court of Public Opinion is coming out to support you guys and saying, hey, this just isn't right. This isn't about politics. This is about saving lives, and this doesn't make sense, and we need to have more dialogue on this. So has this continued to grow even through over the Christmas time here? You guys still getting boots in? Sierra's laughing. Go ahead, Sierra.
Oh, like there's constant, like Kate and all of us we're getting constant messages from people being like, can I bring my boots to the next one? Where's the nearest drop-off point? Like constantly. And so that's like still growing for like when we do the next tour, which we haven't decided on dates yet. But not only are we getting messages about more boots, which we are continuing to collect at all of our drop points, but we're also...
Your turn to go all R2-D2 on us.
Oh, no.
Maybe...
The good news is I heard her.
Oh, did you? Oh, maybe it's just at my end. Good.
Oh,
sorry for everybody.
Yeah. Not only that, but we're getting messages from other people in other provinces being like, "Hey, Alberta Boot Project, are you guys going to come to Ontario, New Brunswick, BC? How do we start our own?" So we were contacted so much over the Christmas break that I have guilt.
and the one thing which I think has been totally awesome is as much as we very much care about all our patients and everyone else in Alberta, one of the important things that we learn is mental health in our individual lives is that if we don't take care of our own mental health, we can't help anyone else. It's been sort of the whole idea of being selfish to look at yourself first. It's been a bit turned on upside down on its head that, and so we've actually have all pretty much taken a bit of a break to be with family and friends, to focus sort of on what matters beyond just what's going on right now. And we sort of taken a bit of a step back over the Christmas break here. I have to edit photographs of some 640 shoes, go through some 3,000 different images, building our website that's currently with a countdown timer and such. But we just really had to take a bit of a pause on thing, and thankfully in some of a way with the mandate being put on a pause-ish, it has given us a chance to have a step back and take a deep breath in that regard. So, but as Sierra said, send all your contacts if you want to start up a boot program to Kate. Yes, she's probably gonna get mad now that she's not here that I said that.
Voluntold.
Yes. But yeah, it's all very much an organic grassroots things that has started with just a few people saying, "Hey, we need to do something," and one person having the fortitude and audacity to get us all going together. Kate, there's your compliment, to organize that. And that's all it takes. You don't need thousands. You need a few core people who really want to make a difference, and then someone with the drive to be able to just keep pushing it. But we'd be happy to talk with anyone who's looking at wanting to start their own program, or I should say project. Whatever you want to call it. You can make up your own name. We realize this goes beyond Alberta, and hopefully this just starts the movement even further.
It really does, and we're kind of winding it down here now, and I thank you for hitting on a few of those points, because that I wanted people to hear out of all of this. Going into the new year, you guys are going to continue on with your displays, and you're going to continue on with telling the story. This I am profoundly grateful for, and speaking for our audience and in saying so as well. And anybody else out there, if you guys didn't catch their website address down there, and if you can't get a hold of Kate, get a hold of us at What's Up Canada, and we will make sure that you get connected with them over there. Anything else you guys got going on right now, or your last thoughts, things that you'd like to get out there while you've got the chance here?
Todd, any last thoughts?
Just maybe a couple. Check us out on Facebook. If you don't mind, can I plug an email address?
Absolutely, for sure.
Yeah. So info, INFO, at albertabootproject.ca. And like I said, we're a little bit of a downtime right now with that, but we'll definitely get around to them as fast as we can. And that's a good way to get a hold of us. And
perfect.
Yeah, I see it in the comment section there now. And we're just hoping that this here is the start of the end of these mandates and discriminatory practices.
Yes, and also we really, really want to encourage people to be brave and step out in this project. We didn't step into this project being we're brave, we're going to stand up, we're going to do this. It was more of kind of we got to do something, and then that's how people become a leader, I guess. So, and lots of people are pouring in their thank yous and stuff, even though we didn't anticipate this project to get big. But for people who are wanting to start their own projects, we just really want to encourage them, because not only are you taking on, first of all, a huge project that is going to explode so quickly, but your name is also going to get out there, and social pressure within your job and on social media is so strong, and silence is essentially consent. And if you're not speaking up and willing to put your name on the line, we all know on Facebook they go to town on you, and
that's just taking responsibility for your world. That's what it is. Opening your voice, expressing your thoughts, and taking responsibility for where we're at. And that's why I'm so excited by you guys. You didn't have to be told what to do. You just decided to do something, and just being genuine and finding a little bit of courage and speaking up. And you guys have shown people an example. You guys have set an example. You guys are leaders in your communities, and all of the things that you do, you live by the example of who you are. And this is again an example of that. But what you guys may not have realized is what you guys are actually an example of is the power of the court of public opinion, because it only took a week to 10 days. Are you seeing this, folks? And they got a response. I know that there is groups and organizations out there that have fought tooth and nail for 2 years and have not been able to get a response. But it's the court of public opinion that ultimately makes the rules and decides who gets to make the rules. And when you come out strong enough with the right message, you guys can move mountains, and you guys are moving the mountains right now. So I'm glad you took a little bit of time off. I'm glad you guys found a little bit of holiday spirit, and I hope that you guys get some courage out of what is coming back to you guys as well from the community. I hope that keeps you guys going, and maybe early on in the new year we can find a chance to say, you guys will keep me posted on how big this grows and where it goes. I think there's a worldwide story just starting out in little old Alberta, Canada. So thank you guys all on behalf of everybody here. I hope you guys have a wonderful new year, an amazing new year. Last thoughts?
Yeah, I just want to say thank you very much for taking this time to interview us. None of us are like media people, and I joke as a photographer, I prefer being behind the camera instead of in front of it. And ultimately, I just want to say thank you for everyone who sent in their boots and shoes. We've had even people put their medals on for distinguished service because they felt like all that service that they put in over the years has been absolutely for nothing. And that's really the story that we want to tell. Not so much about us, but so much as about the people whose shoes were empty at the time, and potentially again come March. Those are the stories that we can't tell without these people who have been brave enough to send them in. And many of them, if you see the pictures, just remember every little scuff on a boot and or on a shoe really tells a story of a patient interaction one day. So it's about their story.
I'm real proud of what you guys are doing, because you guys are telling my story too in all of this. And a little bit that I hope that bounces back to you guys is 2 years ago or 3 years ago, if anybody would ever told me I'd have been doing this, I would have laughed hysterically until I peed my pants, because for 20 years you wouldn't have caught me dead in front of the camera. So time changes things, and you never know who you're going to meet and where you're going to go. So thanks for telling our story, and all those out there that aren't getting a chance to do that. That's exactly the spirit of what What's Up Canada was created for. I was frustrated. They were not, the people out there that called themselves media weren't giving people like real people, the real Canadians, a voice or representation even. So What's Up Canada was born, and this is what we live for, is for doing this. So thanks for joining us in our community, and we will talk to y'all real soon.
Thanks, Wayne.
Have a good night.
My pleasure. Have a great New Year's, guys. Happy New Year.
Merry Christmas, Happy New Year's.
All right, guys, that was a real joy. A little bit rusty on my production end, guys, but we've got lots of good stuff coming in the new year. Stay tuned and get a hold of these guys, give them some support, give them some love, get their message out, follow their example. If you guys want leaders, they are out there. All you have to do is take part and be your own leader. And that is all it's going to take for us to make Canada Canada again. All right. Good night. God bless. Thanks for hanging out with us all here tonight, and stay tuned. You never know what's coming next at What's Up Canada. Bye for now.